We could hear you, definitely.
Oh,
Yeah.
see, I didn't know.
Okay, 7:52. Let's get Dr. Vince Akimoto on the line here. Doc, I know you've had a very, well, let's just say an eventful last few days.
Yes, I'm glad to be free again.
So have
You're free.
you've been tested? Are you cleared of COVID-19? What's the latest with your situation?
I am clear, very grateful to be coronavirus free at this point in time, but gonna go to work today and take care of people that are worried that they might be infected. And can I just be clear that my concern about being infected was mainly about my family, and if any of them who had it might be made really sick by it, because I think that's what we're seeing. But the majority of people probably would have felt just like I did, which is maybe a little tired. But I think we're tired because we're all staying up too late and worrying about important things. But in all reality, I didn't have a fever. I didn't feel very sick, but my staff thought I didn't look good, and I've been coughing a little, maybe too much. And so they slammed me up against the wall and took a sample. And then once they took the sample, I was out. And, you know, again, I think everyone should err on the side of caution in terms of exposing others. Getting tested really is still becoming, there's still a controversy. We're going to get more tests. And it looks like Vice President Pence and his wife are getting tested, even though some claim they don't have any symptoms. So there's inconsistency in how this should be applied. But what's consistent is that a lot of people are going to get infected. 80% of the people in that room that you're broadcasting from are going to get infected if all the models hold. And what happened last night was a correction. That's the number that we should be at. We should be seeing this kind of exponential rise, just like they've had in Italy and every other place around the world. Guam is exceptional, but we're not going to be protected from the effects of coronavirus. And I don't think we want to insulate ourselves. We need to learn how to deal with this. We need to get through it. We need to evolve. And I'm happy to tell the people of Guam we have excellent medical providers out there who were working all weekend. I mean, it was exhausting to watch them work while I was stuck in my quarantine room. They were having meeting after meeting. They learned how to use Zoom, just like Sabrina did. And they were doing all kinds of amazing things with the governor and her team. There were a lot of kumbaya moments, and I think a lot of hand-holding and I'm sorry's and all that kind of stuff. And the medical team on Guam is newly formed, newly committed, and I think newly united. They're meeting right now with the governor again. There's just a whole lot of very high-level government and medical work going into protecting you, making sure that when you get sick, if you get sick, that you will survive, going into making sure that we contain this so that the spread is slow and easy, so that we can absorb the hard hits. There will be some people that will die. This is not a drill. The unfortunate woman who died the other day, that's typical. It's going to be the weak, those people on dialysis, those people who are smokers. Chris, gotta quit, Chris. You're not smiling. Okay, so the thing is that we're doing this for you. It's not easy. It's not pretty. And some of the healthcare professionals are going to get sick. Some of the priests are going to get sick. It makes for high drama, but this is the time to listen to your government and trust that your government's going to generally do the right thing. There will be missteps, but this is why we have government. This is why we put faith in leaders, and your leaders were working really, really hard this weekend. So please don't give them a hug, but maybe a 6 foot away high five or whatever you can do to acknowledge that they did work. Some of the things they had hoped for didn't come through. Some of the things they said turned out to be untrue, and I'm sure they feel bad about it. But this day is a day for rejoicing that we're making it through our first week of COVID-19. I have no idea how long this is going to last. I think it's reasonable to expect this is going to last a long time. So don't eat all your food this week.
Oops.
Try to pace yourself, and really do look at this as a long journey where we're going to all have to share and take care of each other. But know that Guam is in a really good position, despite the fact that we are getting whacked right now. There are way more cases than 20 whatever they're saying it is, because remember, we weren't testing at all.
Right.
Hawaii's the same. But if we're like Taiwan, if we're like Singapore, where they had bigger problems because they were much more crowded, not a lot of us are going to die. What we want to do is save the hospital and their staff from having to deal with too many unnecessary problems. Don't drink too much. Don't get into car accidents. Don't have a heart attack. Don't have a stroke. And if you do, go to GRMC, save GMH for COVID-19, and please protect each other. If you're sick, stay away from your family and just be smart. Listen to Chris and Sabrina.
Doc, let me ask you just real quick. Yesterday we were able to run 35 tests. Are you in the loop at all? Who are we testing? Are we testing people who might have come into contact with positive patients, or are we just testing whoever turns out at the clinics with the symptoms?
No, those tests were collected Thursday, Friday, maybe some from Saturday. And remember, they said they could only do 20 a day. So, the government's always kind of, under-promising and over-delivering, because they said we couldn't do these tests until April. Then they did it in 2 days, and they're saying they can only do 20 tests, and then yesterday they did 35. Reality is there's a lot of tests being run in the clinics like ours. AMC saw probably about 350 people to spare the hospital emergency rooms, and we did a lot of tests. That's why one of the reasons the nurses were concerned about me and Dr. Wen, because we were doing lots of tests on people with fever and cough. So we were very sure that we were going to get positive patients, and we did. We got quite a few that were positive. So we're not fooling around. This is going to infect some of your doctors, and then they'll do the right thing and stay out, get better, and be stronger, just like you will. So this is doable. Your immune system was created to protect you against scary things like COVID-19. So just stay healthy, stay positive, and
stay home.
And stay home.
Right.
Stay bored.
Yeah, stay bored. That's my.
Come on, you guys.
That's my quote for the day. You won't.
What kind of attitude is that? Put your smiley faces on and entertain the people.
There you go. Well, thanks, Doc.
Have a good day.
Take
Anything
care.
else? Wait, is there anything else? Because there's always something with you. Is there anything else that we need to know?
I got this rash, Chris.
Okay, yeah,
No,
that's
no,
a
no,
little
it's
too
okay.
much information. Yeah, go to GRMC with your rash. Spare GMH. There you go, Dr. Vince Akimoto at 7:59. Couple comments we had here from Lena on our Facebook Live.